Good evening, everyone. Welcome to Talk the Wellness Tea with Dr. Chalice. I am so very excited that, tonight we have a whole panel full of phenomenal women. We are survivors. We have one thriver. And I'm briefly just going to take a little bit just to tell you briefly about me. So I'm Dr. Chalice Rhodes. I'm a licensed professional counselor. I'm a breast cancer survivor, a very recent breast cancer survivor. I've just completed radiation treatment last December. So I'm coming up on a year, y'all. I had a lumpectomy last September, and I decided to turn my pain into purpose and specialize in cancer oncology, behavioral health, and to give back to our community. So one way that I'm doing this is through our Talk the Wellness Tea podcast. And I am so excited to announce our phenomenal panel. First, we have Dr. Morgan Mitchell, who is a biochemist and professor. So welcome, Dr. Morgan Mitchell. And then we have Tolu. Tolu is a research program manager at the University of Pennsylvania, but Tolu is also a thriver. And Tolu is going to explain to us what that means. What is the difference between a survivor and a thriver? And next up, we have Dr. Bola. Dr. Bola has her My Breast Cancer Journey Optimistic and Feisty podcast. All right, so Dr. Bola is also a survivor, and she's going to share her story as well. And last but not least, we have Dr. Lakeisha McGee, CEO of Heal Her and Him 2 Consulting and Heal Her 2 Foundation. So welcome, panelists. We're each going to take like 10 to 15 minutes just to share our story. So our topic for tonight is, how are we navigating our breast cancer survivorship and thrivership in terms of our mental, physical, and spiritual health? So why don't we start with Dr. Morgan?
Hey, you guys, I'm so excited to be here with you tonight and share my story. So thank you for having me. So my name is Morgan Mitchell, or some people call me Dr. Morgan Mitchell because, interestingly enough, I graduated with my PhD in biochemistry in the same month that I got diagnosed with breast cancer, which was in August 2020. And it was during the middle of the pandemic before vaccines. So it was a super, super crazy time. But let me back it up a little bit. So it was July 2020, right, when we went on lockdown for COVID, and the world was like basically in chaos, right? Because we didn't know what was going to happen. People were saying to stay at home. It was just very scary, right? People were dropping like flies, and we just did not know the future, right? So a super scary time. So during July, so I was 34 years old at the time, right? And breast cancer doesn't run in my family. So because I was 34, that means I was too young for self-exams. I hadn't had a mammogram yet. I hadn't had any of that, right, due to my age and lack of family history, right? So I just happened to brush across my breast one night, and I was like, okay, whatever, shrugged it off. But then the next night, the same thing happened, where I can't really tell you what I was doing. I was, putting on my pajamas and just happened to stroke across my breast. And then I went into my mom's room. I let her feel it. She said, yeah, there's definitely something there. Making an appointment with your OBGYN. I did that. Within a week, I was in my OBGYN's office. And she said, yeah, there's definitely something there. She said, it's probably a cyst, which, these are very common in African-American women. She said, I've had 3 in my lifetime. And her advice was, whatever it is, if it's cancerous, non-cancer, just get it out. And so then she referred me to her breast surgeon that has removed her cysts, right? And let me heavily emphasize this. Both my OBGYN is a Black woman, and her breast surgeon that she referred me to is a Black woman. So I'm talking about that's Black women taking care of Black women, right? They had me in their office within a week and a half. Okay. So you need doctors who truly care about you. You're not just a number, but they take care of you as they would their own children. Okay.
Yes.
So after I went to the breast surgeon's office, she did a biopsy. And then 5 days later over Zoom, right? It was over Zoom because it was the pandemic. She told me that I had breast cancer, probably stage 2. And I was in shock, complete shock, because again, this came out of nowhere. And it was just shock, right? And then it was very terrifying because it's kind of like the worst time to have an illness when you have a pandemic and we don't know what's going to happen. There were no vaccines. It was just very, very terrifying. What also was terrifying is that, you know, once I started chemo, right, I'm now completely immunocompromised, so you can imagine, I mean, 6 feet away, people had to stay, like nobody could come close to me at all, right? Because that could have been a life and death situation for me. And it was really, really hard because this is a time where I need physical embrace and hugs and love. And I just want my family to hug on me. I want my friends to hug on me. I want my people to hold my hand and be like, we're going to get through this together. And it was really hard, because I was restricted to Zoom calls and FaceTime and, people driving by and, hey, wave, stuff like that. It was really hard. At the beginning, even in the doctor's offices, there was a 3-person maximum. So that's me, the doctor, and the nurse. So a lot of these things, my family wasn't with me. I had to take a lot of this by myself. That was even harder. But we got through it. So I went through 6 months of chemo. I did a lumpectomy. I did radiation for 6 weeks, and then I did targeted therapy because my the type of breast cancer that I have is hormone dependent. So basically, hormones feed the tumor, and so because of that, they're able to target those specific hormone receptors, which is it really helps out a lot. So yeah, I did all of that, and now I'm cancer free. And yeah, thank you. So it was definitely, when this first happened and I first got diagnosed, I wasn't happy about it. Obviously, it was so emotional. It was shock. It was, anger was in there, sadness was in there, and confusion, really. And I kept asking God, like, why? And it almost feels like a punishment, right? Because it almost feels like, what have I done so bad that I deserve this, right? That's how it feels.
Yeah.
And it's really hard, but now I'm just so thankful and grateful that I'm on the other side of it,
Yeah.
because now I get to see a lot of the why, right? And I get to see, okay, why God chose me and chose this journey for me. And it's because I'm a young African American woman who did not plan on having breast cancer, was not testing for breast cancer, didn't have a mammogram, hadn't done any self exams, and I got breast cancer. And then on top of it, I'm a scientist. I've been in school for science my entire life.
Wow.
So if it can happen to me, it can definitely happen to anybody.
Yes.
And I say this too, the number one risk factor for getting breast cancer is having breast. So that means being a woman. So it affects each and every one of us. And basically for me, I just try to pay it forward. I'm here again because of the sacrifices and the decisions that other Black women have gone through before me. Teach one, reach one, right?
Yeah.
I'm literally alive because I had two Black women doctors who cared so much about me that they were like, okay, we're getting you in the next appointment, and it went super fast. Okay.
Yeah.
And again, you need at least one person on your medical team who looks like you. Um, and again, just advocating for just knowing your body. You need to know your body so that if something is off, that's when you can go to the doctor and be like, okay, I don't know what's going on, but something is not right. And we're women, we have that intuition already, right? So go with your intuition, your gut feelings, and do your self exams so you have your baseline, so you know what your breasts feel like normally. Again, when something is off, you go to the doctor, right? And then that's their job from then on to figure it out, right? But
Yeah.
you've done your part.
Hmm.
And so yeah, so I'm just here to just tell my story and just get the word out because it's happening to younger and younger women. It's happening at an alarmingly high rate, under the age of 40. And of course, it's going to hit our community the hardest because things always do, due to lack of access, lack of financial means, any of those things, right? So we already have so many strikes against us. And the thing about breast cancer is, you need to catch it early, right? Because you can be cancer free, you can be cured of cancer. If you wait too late, if you get to stage 3 or stage 4, it's permanent. That means there's no cancer free. You're either in remission or you're not. And so it's very, very important. And I think us as Black women, you know, we say all the time, like, self care, but we have to actually apply it. We have to actually do it because if Morgan is not okay, then Morgan is not going to be good for anybody, right? So you have to pour into yourself, right? And so yeah, I'm here and I just love fellowshipping with the cancer community, my Black women, thrivers, survivors, patients, everybody. We're all in this together. And also I say all the time, it's up to us to save our community. There's no superhero coming in here to save us. It's up to us. We have to save each other.
Yeah.
Um, so yeah, so
Oh, thank
thank
you
you
so
for having
much,
me.
Dr. Morgan, for sharing your story. I can't imagine, like you said, COVID and having to be alone. And right when you were getting your degree, there's never a good time to be told, hey, you have breast cancer, right? So I just thank you so much for sharing your story. And we are going to move on to Tolu. Tolu is a thriver. Tolu, please share your story and tell us the difference between a survivor and a thriver.
Hi, everyone. Thank you so much for this opportunity and this platform to share my story. As I was listening to Dr. Morgan speak about her story, it was just so shocking because this is my first time also hearing some of the panelists' story. And it's so shocking just the similarity and really how connected we are and how much, when you're going through things, you think that, oh, I'm the only one in this world who's going through this thing. But really, what Dr. Morgan just explained is something very similar and a very similar experience to what I experienced. So, again, my name is Tolu Oyetunde. And I am a breast cancer thriver. So what does that mean? That means that I am still living with breast cancer today. And it's really easy to share your story after you've gone through it, right? Like after being a survivor, I call myself a thriver or a survivor by faith because I wasn't fortunate enough to catch the cancer early. It was already to stage 4, metastatic, which had spread by the time that I got diagnosed. And, I'm going to talk a little bit more about that. But to start with the origin of my story, very similar, like I said, to Dr. Morgan. I was completing my dual master's degree. So I was studying my public health and nonprofit leadership degree at Penn. So I had finished my MPH and I was just wrapping up with my nonprofit classes. And I was also working at the health department doing COVID containment. So I'm like, when you think of in the thick of it and public health and like COVID containment, we were in the thick of it. We were, one of the first 3 hires at the health department, really trying to like make sure that we're doing contact tracing, building the department up. Really like I was like, yes, I'm a graduate. And then I'm also like doing what I'm passionate about, helping our community. And as I was finishing my coursework in July, I felt a lump. I was also doing a fitness challenge. So this is when the world was shut down. We're at home. So I literally was like, work out, work, do homework, work out, work, do homework. So I lost the weight, and that's how. But it was like I woke up when I finally finished my classes because it was just back to back to back, like work, right? So when I finished my class was when I like realized like I feel something in my left breast. And, like Dr. Morgan said, in a pandemic, it's not like you can just easily go to the hospital. A lot of people weren't doing office visit. So, I'm like trying to like call the hospital and saying, I think I feel something. And they're like, explained a lump. So, when I explained the lump and how big it was, they were like, oh, you need to go get an ultrasound ASAP, right? So I went and got an ultrasound. And, very similarly, no one can come to the hospital with you. So really, when you're in COVID and you're getting the diagnosis, a lot of it is by yourself because there's, no one with you. And throughout that, I was kind of like, because no one in my family that I knew of had breast cancer. Like I was 26 years old, very young, no like history, no history. I was healthy. I've never spent a day in the hospital. So like I was also thinking, oh, maybe this is a cyst. Okay. But then, I would go for the ultrasound, they would be concerned. Then I did the biopsy. That was really difficult doing it by myself. They told me that it was going to be a very easy, quick, and fast procedure. It ended up being very painful. And, having to go through that alone because no one can come to the hospital with you, that was really difficult. And then finding out, okay, so this is breast cancer, not just as this is breast cancer, doing more tests and figuring out, okay, it's spread to your lymph nodes, it's spread to like your liver, it's spread to your lungs, like that, all of that kind of happened all at once, right? So, getting diagnosed at a later stage, very early, was really difficult, right? There was a lot of, you know, like Dr. Morgan said, like, God, am I being punished? Like, what did I do wrong? Why, I'm just now finishing my like 2 master's degree. I thought like my career was going to take off. Like I have all these goals, all this ambition, like all of these things I want to do. And in the midst of it, it's like, damn, I'm just getting hit by like a train, like what
Yeah.
is it? And not just I have breast cancer, but I had stage 4 breast cancer. It's not like I thought I had a family history, never had a mammogram. I'm 26. Like I'm thinking, I'm in my 20s, right? And so that was very, very difficult. And I would say in the beginning, I have, even though my family are not close by, prayers has always been something that, have I've been praying, like my family has been praying, even when I feel weak, like having my family pray for me was really, really important. And when you're in it, you you can get very down, right? Like even if you see like, oh, other people are surviving and you're hearing those stories, when you're in the thick of treatment, you don't even see the light, right? You don't even see like you're not even thinking about survivorship. Most people who are survivors had early stage cancer. So it's like you're
Yes.
not even, like you don't even feel like you're connected to it. So there was like this initial like depression that came with it. And, I started treatment and everyone's like, when are you done with treatment? When are you done with treatment? But when you're like, metastatic cancer, they don't tell you a treatment end date. They are like, we just keeping you alive as long as possible, right? So
Wow.
there's like what the doctor is saying, like what the medical professional is saying, and then there's like this faith that you just have to hold on to, right? And I used to be part of a lot of like support group, just like for young survivors, because even like when you're 20, I was like, I still have a career. I still have all these goals,
Yes.
and I was trying to figure out, okay, who can I like ask about like, how you process it? And most people had like early stage cancer. So there wasn't a lot of people that I can talk to that were my age that I can say, what is your experience? Because it felt like no one, not even in the support group, understood, because they just did chemo and radiation and now they're like in remission, right? Whereas
Yeah.
like my process is a lot longer. There is no like end date for chemo. There is no like, it's not like as linear as those with early stage cancer. So it's like, how do you navigate dating? How do you navigate like career? How do you work? Like, what does this look like, right? So, that is one of the reasons why I've decided to share my story, even though like at first it was like maybe I should wait until I'm healed to share my story. But then I realized that like, I bought a house, and a friend of mine from the group was like, I can't believe you signed a 30-year lease. I mean, a 30-year mortgage. And I'm looking like I'm not planning on going anywhere anytime soon, And like that's me holding on to like that faith that yes, I know what is real and I know what like the doctors are saying, but I'm holding on to faith that like God is gonna heal me, right? Like I serve a God who like does miracles, and that's all I can hold on to. Like I literally have nothing else to hold on to, because if I go by only fact, well, fact is I was only supposed to live 2 years and now I'm going on 4 years, right? Like so,
Yes.
like so, so basically like understanding like yes, these are all of the facts, like recognizing it and feeling, but also knowing that like you know for me, really holding on to that faith. And you talked about like spiritual health, but also like, really just holding on to your faith, number one. And then also mental health. I had to realize, I don't want to take too much time. I can't remember how much time I have. But for
Oh,
me,
5 more minutes.
okay. So for me, it was like, I decided that I wasn't going to just let the situation um define who I am as a person. So this is actually my first time sharing my story on a very public platform, right? Most people
Oh,
see me and they have no idea that I have breast cancer, right? I shared my story for the first time on Friday on a public platform, right? So many people were shocked because I refuse to make my life, I refuse to center cancer in my life. I am much more than a cancer patient. I am an educator, right? Like I am a research program manager. I am a daughter. I am a friend. I love to travel. Like really, it made me travel more, right? Like I have decided that yes, I have cancer, but this is not the end of my story, right? This is just a part of my story. And I'm hoping that as speaking out, especially to those who may be 26, maybe under 30, maybe under, 40, who didn't even get a chance to be diagnosed early, that ended up being diagnosed with stage 4. Like, no, it's not your fault. There's nothing you could have done to, you know, to catch it earlier. Like I had no idea, right? So, you know, there was a lot of like that self-blame and that what did I do? And you have to leave that and like just move on this path of journey of healing. And I will say like, you know, it's really hard when you're in the thick of it to see like why am I even on this journey? Like, why, God, like, why did you put me on? Right. But honestly, like, it's opened so many doors that, like, now I'm working in, cancer research in Nigeria, really trying to, like, talk about the disparities that we have, not just in America amongst African American women, but also amongst, like, the diaspora, because we're seeing women, not just in the US, but all over, even in low and income countries that are suffering with no mammograms, no screening, like not even a quarter of the access that we have here in the United States, right? So it's like, how do you talk about prevention in communities like that? So that, I think I love Dr. Chalice, as you said, sharing your story into a purpose. I've decided that, like, you know, I don't have to wait until I'm like completely healed to share my story, that like you can be in the thick of it and start using your story for good. So that's a little bit, how do I like cope? I travel a lot. I have great family and so much support. Like my support system, I'm so thankful to. There's so many of my family members on this call, so shout out to you all. Thank you so much. And I just thank God for my life. Like Jesus got my back, and like that is literally the only reason why I'm here today. And there is no other reason. Like honestly, my life is like, I say every single day that I like breathe and I'm alive is like a miracle, right? So yeah, that is.
Oh, Tolu, you just warmed my heart. First of all, you shine so bright. You just like looking at you, like you have this glow about you. You're right. God is with you. Thank you so much for sharing your story. And you're right. I'm so happy that you did not wait. You did not wait, because that takes a special bravery and courage to come and share your story, and you're still in the midst of the process. But your story of faith and hope and perseverance, let me tell you, inspires so many. And like you said, so many young women, you were in the thick of doing a physical fitness challenge. You're at the, precipice of your career. It's just about to take off. And you hear stage 4 breast cancer, and you are so right. And I say it all the time, the same as you, Tolu. We are so much more than a breast cancer diagnosis. So the fact that you're living life, and like the things that you talked about, I talk about in my Thrive Breast Cancer Survivorship course. So if you download my app, if you go to your app store and download my Dr. Chalice Teach app, it's called Thrive Breast Cancer Survivorship, and I touch on all things breast cancer. So you're right, dating with a breast cancer diagnosis, navigating family relationships, friendships, all kinds of things for married people, single people, physical health, all of that. So Tolu, thank you so much for sharing. We are so happy that God saved all of our lives, but to see you, still living, with the disease, and to see you still thriving, and, you earned your dual degrees, and you're at the University of Penn being a research program manager, and then you're reaching back to your country, right? To help others who, like you said, in low income environments where the technology that we have in the United States is not the same technology, that is back home for you. So reaching back into the community, just thank you so much, Tolu. Yes, and also sharing, your mental health, like the depression, because it will make you feel depressed. As a cancer oncology behavioral health specialist, one of the things that we do is we do the distress thermometer, because when anybody hears the word cancer, you experience some form of distress. And for some people, it can show up differently. Like for you, you stated it showed up as depression. For me, it showed up as extreme anxiety. Like I was scared. I was like, well, I was worried. All these thoughts were going through my mind. I have 2 sons. I was thinking of my sons. But I'm so glad to hear you, say how it showed up for you, like that feeling of depression. For me, it was anxiety, and maybe for others, it's the same or maybe different. So thank you so much, Tolu. Next up, we have Dr. Bola, optimistic and feisty. All right, Dr. Bola, let's hear your story. And I can't wait to hear about this optimistic and feisty side of you. I experienced it, though, Dr. Bola, on your podcast.
Awesome. Thank you so much for being here. Thank you for inviting us, Dr. Chalice.
Yes.
So if you guys listen to the podcast, you would hear me mispronounce Dr. Chalice's name.
You
finally got it together now.
Yes.
But yeah, so your story really resonates with me, Tony, because the breast cancer journey is only a part of our testimony. It's not the entirety, right? It's not even the end of our testimony. So I love that you harp on that tremendously. And also for Morgan, Dr. Morgan, I love that you went into like, yes, you had finished all your education, and it happened at a time, what, in 2020, when the whole world was turning around. So it was great to see you move forward with that and go through your treatment process. But one thing that I realized is throughout that process is the presence of God never left you at any point in time. So that is remarkable by itself. So I'm a talker, as y'all can tell, but I'm gonna keep it on myself. So my name's Bola Godimo. I got diagnosed actually with breast cancer in 2021. So I had previously worked as an oncology nurse, both pediatrics and then adults,
Wow.
back for like the last 20 years, essentially, before switching to infectious diseases. So I had given the chemo, I had accompanied patients to radiation. And
Wow.
so when I first got that, and I also had like family member that had other kinds of cancer, from colon cancer to endometrial cancer to melanoma. So I'm like, okay, I got this. You know,
Yes.
I know God was laughing at me like, baby girl, you got this, but I got you even better. Right. So then I was doing my routine self breast exam. It was nothing that I noticed. But in because of the family history, I had already started on the screening. At the time I was 44 years old, had
Okay.
had two kids. They were older, it, a, above 10 years old, essentially.
Okay.
And so I had gone through the colonoscopy twice. I mean, I started pretty young. The skin screening, yes, did all of that. So I thought I got it, right? And
Yes.
so my routine screening um with a mammogram initially, the first year that I started, I was in my 30s. That was 2017. And that didn't show anything. Of course, the following year, my radiologist had said that I had like dense breast tissue. So,
Mm-hmm.
okay, fine, we'll do the ultrasound. So then did the ultrasound, and they ended up coming back and telling me that I have multiple pockets of cysts. I'm
Yeah.
like, okay, sure, whatever. My mom had the same thing too. So I didn't think anything significant,
Right.
particularly since every single month my self breast exam was normal,
Yeah.
right? And so fast forward to every single year, I would continue to get the annual testing done, and it was all normal, 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 just the fibrocystic breast disease. And then 2021, I had the mammogram done for that year, as well as the ultrasound. And they called me back actually after the ultrasound and said, well, there might be some suspicious cysts was the terminology on the right breast. I'm like, it's probably just the cyst, nothing, right?
Right.
Again, I thought I was prepared for the other kind of cancer. Nobody in my family had breast cancer. So I didn't think anything of it, right? But I ended up making that appointment because they wanted a biopsy done. So got the biopsy done. And 2 days later, a radiologist calls me and says, well, Bola, yeah, this is looking like DCIS. That's what your pathology says. So I said, well, okay. So I will say right off the bat, my initial defense mechanism was denial, right? I was like, no, no,
Yeah.
no, not me. So here's how crazy I was. I was calling the hospital because I'd worked there before,
Okay.
and I was trying to see if pathology lab could double check that it wasn't somebody else's. I wasn't wishing it on anybody else, but I was saying,
Right.
not me, right?
Yes.
But then they confirmed, yes, it is yours. So then I went into, okay, my second level of defense was another source of denial. So I started reaching out to like support groups to see if I could find stories that correlate with like a miss or confused diagnosis. And one of the people that I ended up reaching out to was with American Cancer Society. It's called Reach to Recovery. It's like a peer support program.
Yes.
So the lady that I reached out to, she had called and she was an African American lady. And so I'm telling her all about my family history. Like I just said, I'm a talker. So she let me, vent because I was frustrated. I didn't understand a whole bunch of things that were going on in my body. Right. And so at the end of it all, I then asked her, I said, well, what's your story? And she said, well, Bola, you got time? I said, yeah, sure. What I didn't know at the time, now she's a 20-year survivor.
Oh, wow.
She had initially gotten diagnosed with the same kind of cancer that I had, DCIS on the right. And at the time, her son was 3 years old.
Mm.
She was a model and she was in a PhD program. So she wanted to get back to work, right away, right? So she did a lumpectomy and her went about her business. But then 3 years after that, she started passing out. And then they found out that it was actually met to her cerebellum, the base of her brain. And I say this because she's online and you can read up about her. But
Oh,
she was a stage 4 within like 3 years.
oh my
And so at that point, they had told her son was 5 or 6 years old. They had told her that she had maybe 6 months to live, to just go ahead and like do the videos for his elementary school graduation, his middle school graduation, his high school graduation. And they had told her she would definitely not be able to see him through college. And so she ended up just committing herself to prayer and really laying down at the Lord's feet to say,
yeah.
God, just take control. And as she told me her testimony, I said, what? But I don't understand. But why me? Why me? She's like, Bola, let me tell you something. Why not you? So she put that challenge on me, which was so beautiful
Yeah.
because at the time when I was, like stuck on myself,
Mhm. Yeah.
she brought me back to reality and she said, you know what? Why not you? Because God wants to use your situation and wants to use your story. And I say this because her son's actually going to be graduating from college this week, actually. Yeah, this week. Yes.
Oh,
So
yeah.
she is 17 years post stage
Oh,
4.
yes.
And she
Oh,
is
Tolu, listen to that.
she is so feisty. And I mentioned her because when I started my podcast, to tell my story and to tell my testimony and to get everybody's testimony, I always remembered what is the lady had told me. She said, Bola, pick up yourself by your bootstraps. You gotta stay feisty, girl. You will fight this. You
Yeah.
owe it to your 2 sons. You will fight this.
Yes, ma'am.
She didn't know me from Eve, but she saw that in me that I did not necessarily see in myself. It was only by the power of God. And it still is even now. So I say that story because, yes, it was hard um, from get go, but I thank God because I always say, like, it takes a village because He has put people in my life that I mean, I have my doctorate. I'm a public health
Yeah.
infectious disease specialist. I couldn't even think of these things. There is no way. It was only God who really would have made everything possible in every possible way, right? It's only been God this whole time. So, but yeah, I know I've taken a lot of time. Like I said, I'm a talker, but yeah, but that is my story.
Yes. Oh my God, Dr. Bola, thank you so much for sharing. I'm with you. I also had a diagnosis of DCIS
Yeah,
in the right breast. I am so
yeah,
grateful for my life. I am so grateful for early detection because
yeah.
early detection really does save lives, guys. Like,
Mm-hmm.
listen, in 2017, they said
Mm.
that I had a cyst on my
Yep.
breast. They told me the same thing, Dr. Bola. I had dense
Yeah.
breasts, but nobody made a big deal. I didn't find out until after I became a survivor that dense
Yep.
breast is actually a risk factor
It,
for
it
breast
is.
cancer. So for all
Yes.
those who are listening, if your doctor tells you that you have dense breast, you need to make sure you are also getting an ultrasound and in some
Mm-hmm.
cases an ultrasound and an MRI.
Yeah.
So please advocate for yourself. Don't just let a doctor say you have dense breast and you not
Yeah.
also at the bare minimum have an ultrasound.
Mm-hmm.
Because listen, even after having the mammogram and the ultrasound, they said, oh, it's just a cyst. Do you guys know 5 years later, whoever the doctor was, and I got the name and I wrote it
Hmm.
down, I just can't remember. I'm so thankful for the doctor 5 years later who said, you know what? Let's just biopsy this just to see.
Yeah.
And they biopsied it, and guess what, guys? It was deep ductal carcinoma in
Mm-hmm.
situ or non-invasive stage 0 breast cancer in my right breast. I am so grateful for my life because God kept me for 5 years. That breast cancer did not escape out of the milk duct. It stayed there. Now, when my surgeon did the lumpectomy, she said it almost escaped. She
Yeah.
said it was right there on the edge. So listen, we are all so grateful for our lives. And without further ado, thank you, Dr. Bola. We're going to move on to last but not least, Dr. Lakeisha McGee. Hi, Dr. Lakeisha. Oh, let's unmute your microphone so we can hear you. Let's see. Can you unmute?
Yes, I can unmute myself.
Okay, good.
Hi. So it's so funny listening to everyone's story because I hear a little bit of my own story in everybody's story. I too was in school. I was finishing up my PhD at the time. I was in the thick of finishing up my PhD when I found out that I had breast cancer. I was on a high school tour for my daughter. We were looking for high schools for her. And the summer, I'm originally from Chicago. So in the summer, I go home. I was home for the summer and I was seeing this brown stuff in my bra. And I told my sister, I'm like, I got this little brown spot in my bra. And she was like, you really need to go and take care of that. And I said, okay, well, it's summertime shy. After the summertime, when I go back to California, I'll make sure to go and get an examination. And I
Yes.
did. When I got back to California, I contacted my doctor. I told her what I was experiencing. They took me, called me in. I went and got the test. Once I saw my doctor, she said, I think you need a biopsy. I went and got the biopsy done, and the results came back while I was on a high school tour with my daughter. So immediately she says, Lakeisha, I know how you are. And we don't have to wait for you to come in. It came back positive. You have breast cancer. But she said it was DCIS as well. So
Okay.
immediately, I'm with my daughter. I don't want to let her know what's going on. I froze and I was like, okay, how do I handle this? So I checked her in, got her all situated, went to the bathroom, and immediately had a breakdown. First thing I heard though was God say that all sickness is not unto death. So I knew that I would be okay. I just knew that this was a walk that I had to walk. It was a testimony for others. I knew that, but that does not change the fact that you are like, oh my God, what's next? So the first thing I felt was embarrassment. I don't know why I was embarrassed,
Yeah.
but I wasn't angry. I was embarrassed. And I guess, anger and embarrassment kind of go hand in hand. Like, I don't drink. I mean, I may have a social drink here or there. I don't smoke. I run marathons. I eat well.
Yeah.
So, you know what I'm saying? You think of, I'm a good person. How does
Right.
this happen to me? Or what am I going to say to someone? How do I share this with someone? These were
Yeah.
the things that were going through my head. And then, of course, I'm thinking, I have children. Of course, you want to be here for your children. That's just a, oxymoron. You want to be here for your children. So, I wound up going to the doctor after the fact, after I picked myself up, called my mom, my sister, I did all of that. I wound up going back to the doctor, and that's when they told me that no, it wasn't DCIS. It was more serious. I had stage 2, almost stage 3, HER2 positive. I heard someone say that theirs was hormone positive. Mine's is hormone positive. I have HER2. I have triple positive, HER2, estrogen, and progesterone positive. So
Wow.
I'm sorry. Oh,
Oh,
okay.
you're saying,
No,
wow, I'm sorry.
no, I thought I heard you said something. I'm sorry. So, it 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 is definitely better to have the the positives, the triple, positives, the HER2s, because there are things that you can do. They're the targeted treatments, like she said.
Okay.
So, I wind up waiting like 6 weeks, 6 to 8 weeks before I had surgery. In my head, I couldn't leave the hospital flat. And I needed a plastic surgeon to be in there to do the expanders for me. Well, the surgeon that I wanted, that my insurance would cover, they gave me an option of like 3, but the one that I wanted, he wasn't available until January. I found out in November. And I was like, okay, I'm just going to have to wait this out. And so what I did was I started doing herbal. I definitely changed my diet, took out
Mhm.
all meats, I took out all sweets, everything. I got to the point that my doctor was like, because I was having headaches, she said, Lakeisha, you have to eat something. I was like, I'm scared. You get to that point where you're like, I'm scared. I don't know what to eat. So I just, went on a plant-based diet. So when I went back to have the surgery, they actually said that they had shrank. So it was a good thing to
Yeah.
change the diet. It did not change, it did not get worse. It got better. So I had a bilateral mastectomy because they found 3 lumps in my breast. They found one in my chest wall. They found one like on my upper side, and then they found one that was down low. Now, here's the thing. I had been getting mammograms because I was 43 or 44. I had been getting mammograms since I was 40. And each time I got a mammogram, they said it was okay. This lump had been in my breast for probably 2 or 3 years. They never biopsied. I never thought anything else about it because they said it was clear. It had been there for a couple of years though. So
Yes.
yeah. So when they, initially afterwards, when they found it, they said it's 3 in your breast. There's no way we can save that breast. And I was like, that's fine. Take the breast, but you're going to take the other one too.
Yes.
So them both. And I had a bilateral mastectomy. I did, oh my God, 35 rounds of radiation. I,
Wow.
um, 19 rounds of chemo, including targeted chemotherapy. So
Okay.
I was the last person to finish chemo where you can have people in there with you. I finished chemo March 16th of 2020. My family was able to be out in the waiting room with the mask and stuff because 2 days later, the world shut down.
Ooh.
And they almost did not let them in because at that time, the world was preparing for the shutdown. So by the grace, I had someone to go with me every week that I went to chemo. I went live. I shared my testimony. And by the grace, God kept me. I did not look like what I went through, but I
Yes.
experienced a lot. They took 8 lymph nodes out of my arm. I experienced neuropathy, which I still have issues with that to this day. I'm
Mm.
still on what is it called? A nostril. I had to take that for 5 years. It kicked me into early menopause. So because of that, I could not take the other one that everyone else took. I had to take a nostril, which was for people who had now gotten kicked into menopause. So I think I have 2 more years of that left. I lost all my hair, of course, but the
Mm.
neuropathy was horrible. Um, just the whole experience was horrible, but by the grace of God, he kept me. I'm telling you, he kept me. My legs would get so heavy where I could barely move them. of course, we all know you lose your taste, you lose your hair, there's numbness here and there. Even now, when you take the medication for the 5 to 10 years, the tamoxifen, the anostril, you are experiencing joint pains like crazy, severe cramps in your legs and feet like crazy. But I didn't stop. So I was in the middle of my dissertation. I kept going. I created a nonprofit for women because I didn't have a Black woman to save me. There was no one on my team that looked like me. There was no one in the facility that I was going to, maybe 1 or 2 people that looked like me. And it was just not available education and treatment. And I was like, this cannot be. So I created a nonprofit, which is the Heal Her Too Foundation.
Oh, I love it.
It's for Black women because Black women have to support Black women. We have to educate Black women. We have to let them know that early detection is key. Awareness is key. Checking on yourself. Self-care is key. Not only that, we have to also support the caregivers because my mom took care of me and it was definitely difficult for her. She was a senior, but I'm her child. So she took care of me, but it wore on her. So my nonprofit is called the Heal Her Too Foundation, and we focus on the African-American woman. So not only was I in the treatment, at that time, it seemed like Black women were popping up like popcorn with breast cancer. And I couldn't understand what was going on. So I created a book, 12 Shades of Breast Cancer. It's an anthology with 11 other people sharing their stories. And one of those individuals was a guy. And I say was because since we wrote the book, 2 of the people have gone on. And Antoine had fought breast cancer 3 times. And this last battle, it took him out. Lisa had fought it once, but then all of a sudden it came back after 5 years. She had triple negative. And when it came back, she was gone in 2 weeks. It's a forever cycle. When you go for your screenings, you're always in your head. If I get a headache, if I get a lump, you're always thinking about it. There's another young lady in our book. Her name is Shanette. She is metastatic breast cancer. She is now 11 years surviving, and she's thriving, and she looks amazing, and she's traveling the world, and she's living, and she's doing things. She's gone to, I think it's Costa Rica or Africa with this company, and they build houses. Like, she is living. So I say that to say that you're going to live. Like you said, there's no need not to buy a house for 30 years. Why not? You still have to live. You still have to pay rent. You still have to do something. So live your life. You live it. So it has been an experience. It has been a club that I think we all have been given a charge to that none of us signed up for. We all just were thrown into this club, and now we're here and we're doing the best that we can to continue to share and help other women out, and men, because men are affected 2 to 3%. So we do the best we can to share our information and help others because we know we have to pay it forward. We know it's now our charge. We have picked it up and we have to run with the marathon, the baton, and pass it on. So that's what we do.
Wow, Dr. Lakeisha, thank you so much for sharing your story and all your bravery and courage and resilience, just going through all that you had to go through. And like you said, your mom caregiving for you. I talk about, the caregiver's role also in my Thrive Breast Cancer Survivorship. So thank you so much for sharing the importance of that. And then like the fact,
and having small children, and I have a daughter who has autism, dealing with her. I mean, it was a lot.
Yes.
But
God, because like you said, Dr. Lakeisha, you do not look like what you've been through. None of us on this panel look like what we've been through. We are bright, shining lights, beacon of hope, to others, to share our story. I'm just so grateful, for you ladies that you all, came on a panel and joined and was willing to share. We have a lot of people on our call. We probably have about maybe 20 people on our call. T, I know that you raised your hand earlier, so I didn't know if you had a question or comment that you wanted to share. But now is the time where I really want to open up the discussion. What time is it? Let's keep track of our time. So, for the next 15 to 20 minutes, is there anybody that would like to share anything? Any questions, comments for the panel, or just something that you guys would like to share with us? So I don't see anybody raising their hand or unmuting their mics, but feel free to use the raise hand feature, or if you just want to unmute your mic and kind of hop in, please feel free to share, and if not, I'll just ask the panel just some more questions. Let's see from T. Okay, no T. Oh, T was just showing support for the panelists. Okay, T, I just wanted to make sure there wasn't anything that you wanted to share. Thanks for, sending a message to us in the chat. So, talking about navigating breast cancer, I heard you ladies all highlight, the importance of mental health, physical health, spiritual health. I hear that we all have a strong faith in God, and our faith is what got us through. I'm hearing, Dr. Lakeisha, you said that you, first of all, Tolu was in the middle of a physical health challenge. I know for me, I've always been active physically. So I've always, growing up playing basketball, I've always worked out at the gym or worked out at home, or in the summer, I love to swim, and do water aerobics and Insanity Max 30 and Pilates and all of this kind of stuff. Dr. Lakeisha, you said you ran marathons?
I'm a runner. I have ran a marathon again since then. Yeah, that's what I'm saying. When you think that you're healthy and you realize that it doesn't matter if you're healthy or not, there are other factors. There are stress factors. There are family ties to it as well. Even though my family didn't have the BRCA gene, my mother's paternal side has a very strong, and when I say strong, I mean there are 4 siblings. Of the 4, 3 died from some form of cancer. And then if you go to the next generation, their children, 3 out of the 4 of their children died from some form of cancer. And then you go to the next generation, and that generation would be me. And there has been myself and another cousin who was diagnosed with the same type of breast cancer. So there is some type of cancer gene on that side of the family. So even though it wasn't BRCA, there has to be some type of genetic something on that side. So there are just so many elements, the environment, things that we have no control over, the air we breathe, the food we eat, those things that we have, secondhand smoke, things that we cannot control. And it's just nothing we can do about it. But my mental health, I still feel like, and I struggle with this, depression. You do go through depression when you are surviving breast cancer, thriving, treatment, whatever, and you definitely should talk to someone about it. It's up and downs, because when you're having, like I said, when I'm having these bouts of pain, I'm like, Lord, I'm tired of this. Or when and it doesn't go away. So you smile, you keep supporting, you keep encouraging, but then you're struggling on the inside yourself. So definitely the mental health, the depression piece is very important, to seek that support, seek some help from somewhere.
Yes, and thank you so much for sharing that, Dr. Lakeisha, because listen, when I was first diagnosed, I'm like, let me, I'm a therapist, right? So listen,
Me too.
Dr. Lakeisha's a therapist. We believe in therapy, right, Dr. Lakeisha? Like we go to therapy as well too. Yes. How are we gonna be therapists and we've never been to therapy? We go to therapy too. So I searched. I could not, well, especially not a Black therapist that specialized in cancer oncology, but I could not find anybody. And so when I went and met with my surgeon, when she told me about the lumpectomy procedure, we're hitting it off and we're laughing and joking. And she's like, wait, what do you do for a living? I said, I'm a therapist. She said, oh my God. She said, I need you. We need you. She said, I have nobody to refer my clients to, and my breast cancer survivors, like they need the mental health help. I feel like she looked right into my spirit And she spoke that into me. And then 2 weeks later, I received the email from one of the insurance companies that I'm contracted with, calling for mental health providers to specialize in cancer oncology, behavioral health. So Dr. Lakeisha, that's the program I was telling you about. So I said, oh, because we all go, I'm sure we have all, and some of you have shared it. You went through either a brief period of time or for a period of time, like, God, why did this happen to me? Like, I'm in the middle of doing this and that. Why me? Why me? So when my breast cancer surgeon spoke that to me, and 2 weeks later, I got the email, it all came together for me. I said, oh, God, you want me to turn my pain into purpose and to share my mental health experience and expertise and my story of survivorship in the breast cancer survivorship space. So there's not a lot of us out there, whoever's listening, but there are people like me who specialize in cancer oncology, behavioral health. You have Dr. Lakeisha. She's a therapist as well. She's a survivor, so she knows something about this. She's created a foundation. She's wrote books. So while we may be few and far between, we're out here, and hopefully, Dr. Lakeisha, we will inspire other therapists to specialize in this area. But listen, I do want to say, even if you can't find a therapist that specializes in cancer oncology, behavioral health, a therapist is still trained to help you. You have some therapists who are trained in chronic health conditions, chronic pain, definitely depression and anxiety, all of these different, and for some people actually experience trauma, either from the surgery or the mastectomy or the ongoing treatments. You have therapists who are trained. I know, I'm trained in trauma therapy, a clinical trauma therapist. I'm a Christian counselor. I'm a licensed professional counselor. And you can use directories to help you find a Black therapist, because what I hear from a lot of Black women and men is they want a Black therapist. So therapy directories like therapyforblackgirls.com. I love that directory. You can go and you can search by your zip code. It will pull up the therapist in the zip code that you search for. You can look at the therapist pictures. You can go onto our website, read our story. If you go to my website, and I'm sure if you go to Dr. Lakeisha's website, we have our whole professional career on there. So you can get a sense of who we are. And then, like, for me in my practice, I provide a free 15-minute video consultation. So people can actually get on video with me and kind of get a feel for my personality, and see if they think we might be a great fit. Because listen, us therapists, we want you to find the best fit. Even if it's not us, it's okay. Because listen, once you find a great therapist who you fit with, you can do some life-changing work that will change your life forever. And that will help you to transform into that healed, whole, and restored person that you always wanted to be. So, and I want you to share too, Dr. Lakeisha. So I am licensed in Georgia, Florida, Delaware, and New Jersey. Currently, my practice is telehealth. So if you live in any of those states and you need help, please feel free to reach out to me. I don't only specialize in cancer oncology, behavioral health, but anxiety, depression, life transitions. I love empowering women, but I work with men, I work with couples, I work with families. Dr. Lakeisha, how about you and your practice? Would you like to share?
I'm just transitioning to the Jersey, New York area, so that's a whole different ball game. It's crazy that you have to get licensed in every state that you
Every state. Oh,
so yeah, that's a whole nother ball game right now. However, I do run support groups as well for breast cancer survivors and their families. And I do still have contracts in Illinois and California. So
yeah,
you can definitely reach out to me on my website, and we can go from there as far as services, go. But I do, like you said, I work with anxiety, depression, women is my thing. I'm also a life coach, certified life coach as well. So I want to look into this thing that you're doing though with the oncology though. That's going to be
yes. Dr. Lakeisha,
yeah.
I highly recommend that program. That program provides you with some great tools, to get you started, to provide what is needed for the clients. And I shared it with you. So listen, if you want to join me as a cancer oncology behavioral health specialist, and who knows, Dr. Lakeisha, because God might open up doors for us to do something jointly
Absolutely.
in this space,
Absolutely. Yes, absolutely.
Yes. And so eating habits. So I heard Dr. Lakeisha share how she changed her eating habits. Did anybody else? Can anybody else share a story? Oh, and Tolu, I'm sorry. I think you had your hand up earlier. What did you want to share?
Yeah, I just wanted to piggyback with what Dr. McGee said about, working out, eating healthy, and, being diagnosed in fact of that. I think that there's this like thought of like, if I do this and I do that and I do all of these things, then it's never gonna catch me, right? And like, I was a runner, like I was doing like eating really well, doing all of these things. And still I was diagnosed, right? So when you talked about like feeling embarrassed or just, that feeling of like, why me? I think that that's a feeling that we all, when we first get diagnosed, can be very paralyzing.
Yeah.
And, I think the reason why we share our story is that when you're going through a diagnosis and the time you could feel like, why me? Like, why is this only happening to me? But really,
Yeah.
when you look, I'm a public health person. When you look at a population level, there's something happening to Black and, African diaspora. Like to Black women, right? When it comes to breast cancer. And we're not talking about it enough. We're seeing earlier diagnosis. We're seeing at a later stage, it is impacting us. The mortality rate is higher. The morbidity rate is higher, right? Like the type of breast cancer. So I think that, we need to put that on the scientific like field and say, hey, what's going on with our genomics, right? Dr.
Yes.
McGee, you talk about your family. I also did my genetic testing and it came back negative for all the like,
Mhm.
BRCA genes and all of the so like there's something, but when you look at like, who is making up the genomics testing, there's only 3% of folks from the African diaspora that are actually like that we actually know about our genomics. So do we really know what's going on? No, right? So I think that there's also, we want to put that back into like the research community and the healthcare community that you need to engage Black people. You need to like really like we cannot be left out of these conversations. You need to rebuild the trust that has been broken through years of systemic racism and years of systemic, issues. You need to rebuild that relationship and that trust with the Black community. And we need to not be a part and just say, oh, because of this, years and years of systemic like racism, that we shouldn't like do our part in really engaging these community in research, right? We need to know more about our genomics. We need to know more about why we're seeing higher rates of cancer in the Black and in the African diaspora. So, just to like talk about, it's easy to put blame on our own selves. And really, we need to talk about what is happening on a population level.
I love this, Tolu. Thank you so much for sharing that, because what that also means is that we need to start participating in clinical research trials. This is important because my genetics came back negative too. But then how is that positive when after I received a breast cancer diagnosis, an elder in the family told me that my paternal grandmother, two of her sisters had breast cancer, and my paternal grandfather's sister had breast cancer. Breast cancer skipped a generation and landed on me, but my father had prostate cancer. So I think by my father having prostate cancer, that raised my risk a little bit of getting cancer. But so how can my genetic testing come back negative when there's actually, just like yours, Dr. Lakeisha said hers was negative, but then there's people in her family. We need to participate in clinical research trials. So there's an organization called Count Me In. There's also Touch Black Breast Cancer Alliance that has enrolled thousands of Black women in clinical research trials. There's a lot of stigma that needs to be broken down and mistrust in that area, like you were mentioning, Tolu, of the healthcare system and the things that worry us. But there are organizations that can help us participate, because Black breast cancer genes look different than white breast cancer genes. And most of the genomic testing is done on white women, breast cancer survivors. So, we have to do our part by participating in a clinical research trial so that we can affect the generations to come. So Dr. Morgan and Dr. Lakeisha have their hands raised. Why don't we go to Dr. Morgan and then Dr. Lakeisha?
Yes. So Dr. Chalice, thank you so much for bringing up the prostate cancer. That's exactly what I was going to go with, because that narrative needs to be pushed also, right? So if you have, if your dad had prostate cancer, that's 50% that you will get breast cancer. So they can't give you prostate cancer. The men can't give you prostate cancer, but they can give their offspring breast cancer. And so that is very important. So when you talk about breast cancer in family history, you need to be looking at breast cancer and prostate cancer, right? And then also, just in terms of general disease, right? Any cancer in your family is going to put you at a higher risk for any other type of cancer, right? So, yes, we need to talk about this, right? And I agree. We need more Black people in clinical trials, because we need drugs based on our genes. They're all based on Caucasian women, and we're different, and there is something going on. There are some other genes at play. And so we need to know this, but we likewise need to have models. And so that means we need more Black women enrolled in clinical trials. And I just want to stress the fact that, a clinical trial is not, you're not some lab rat with a bunch of tubes hanging out of you, and they're just, trying different medications on you till you die. That's not what it is. And we've got to get away from that narrative too, because in order to progress research, we have to do these things. We got to make some compromises. We got to put some narratives out there. We got to trust science, right? And so, yeah, we need to be doing those things. So the wisdom study is another one for clinical trials, if you want to get more involved with that too. So
great. Thank you so much for sharing, Dr. Morgan. And we'll have our final comments by Dr. Lakeisha and then Dr. Bola. We have about 10 minutes, ladies.
I was going to say, Dr. Morgan, and you kind of talked about it, because I've participated in a clinical trial with Ricky McFarland before. And it wasn't, like you said, with the tubes and all the stuff, it was based on behaviors and habits and different things that we would do or encounter as African-American breast cancer thrivers or survivors. So I wanted to say that it was definitely something that needed to happen for us. And as you also spoke about the genes, there's no way that there's not a gene in my family. And we've had at least 10 people in my immediate family. I'm talking about my mother's father. That's right there. That's my grandfather, and his siblings and first cousins and stuff, to have experienced some type of cancer. And I mean, from brain cancer to leukemia to thyroid to throat cancer to prostate to bone cancer to cervical. That's all of those have been within that. So that means that there is a gene somewhere that is susceptible to cancer. Yeah. And I wanted to say, my daughter said to tell you who she said. She said, she texted me, and because she's on here. She said, Tolo, she said, you ate when you were talking about the abuse and the broken trust of the African Americans with the medical system. So.
Thank you so much, Dr. Lakeisha. Dr. Bola.
And I totally agree. I think Dr. Lakeisha made great points, as well as Dr. Morgan. So our clinical trial representation, I had someone just tell me she's a retired oncology doctor in Texas, and she said something that I had not heard before. She said, well, Bola, a lot of the chemo medications or even the radiation treatment plans or any other treatment plan are based on population studies, which is right. If you look at the majority of the population, they are not typically not of color, right? So it's based on their reactions to the treatment plan, essentially, right? So one thing that I've learned is to not just empower myself, but be part of the clinical trial process. So, and to Dr. Morgan's point, participating in a clinical trial does not mean that you take medications. So for instance, I'm part of American Cancer Society survey. They do like a community survey every 6 months to see if anything or any information you get on their website resonates with you and as it relates to health equity, essentially. And if there's any tweaks in messages that they need to do, then you can make suggestions. So that is one point of empowerment. I think another one that I recently found out about is the Eileen McGyver breast cancer survivorship program that is part of University of Southern California. But it's essentially to look over, it's about I think it's a 5-year time period. That's a study timeline. So looking and assessing what your current status is. So you would have to be stages 1 to 4, and then looking at what specifically you're doing related to your dietary patterns, your exercise patterns, to see if there is any consistency in terms of lifestyle for those that survive, like the 5 years. But I think one other point is I was very disheartened initially with the fact that about 40% of women diagnosed with breast cancer have it coming back, particularly in women of color, particularly in Black women. That was scary to me. It's like, what, 40%? Where'd they get that from? But one thing to note, though, again, it's based on a limited number of population studies. That's number one. So in clinical trials or even surveys, we look at what's the end population. Is it that they surveyed 100 people diagnosed with breast cancer? Don't know, but that's something to kind of keep in mind. But I think one other thing that I've tried to do is to modify. So I used to be a Pilates, elliptical machine kind of fanatic. So now, while I'm on tamoxifen and Lupron post the mastectomy, I don't have as much energy to do that anymore. But guess what? I can walk the grocery store every day. So that's my new form of exercise.
Oh, good.
Adapting to changes. So I can walk every single aisle of the grocery store every day. And that's like 10,000 steps right there. So, hey, that's exercise for me. And that works pretty well. So it's about being empowered by what's going on in your body, right? So just know that you're not there. You're not going to be static. Yes, you may be going through this phase, but it will pass. And God has empowered you to take control and to move forward with lessons learned, essentially. So, sorry, I know we're almost at time, but yeah.
Yes. Dr. Bola, thank you so much for sharing. And before we go to Dr. Lakeisha, because I see you have your hand raised for the final comment, I just wanted to say, Bola, when you said, I think you said 40% of breast cancer comes back, let me tell you guys, stress plays a huge role in cancer. And the majority of our stress comes through our relationships. In my Thrive Breast Cancer Survivorship course, I talk about creating and maintaining healthy boundaries in relationships. Creating and maintaining healthy boundaries in relationships is an act of self-care. And we have to make sure we are managing the stress properly in our lives, because stress feeds cancer cells. Okay, so I know we're running out of time. I want Dr. Lakeisha to say her final thoughts, and then we're going to end our discussion for tonight. Dr. Lakeisha.
I'm sorry, I'm piggybacking because I heard her mention the 40% of the return, but also I'm always amazed that 40% of African American women, our mortality rate, we die at 40%, and we're not even the highest rated race of breast cancer. We just have a higher mortality rate. We're 40% higher than our Caucasian counterpart. And that blows my mind. Also, as far as the treatment plan, as you said, that it's based off of our Caucasian counterparts. When I was in treatment, my very first round of chemo, I ended up in the hospital because the treatment plan that they gave me was based off of what they are used to using. And it was not the right plan for me as an African American woman. I ended up in the hospital 5 days. I had to change the treatment plan. I had to become that amazing advocate for me. I know me better than anybody else. So we're changing this plan. And you have to do that. You have to say this medication is too strong. We cannot do this. Let's do something else. That happened to me.
And Dr. Lakeisha, let me tell you, to say that,
yeah,
I'm so sorry that happened to you, but your story is proof. And this is actually proven in research. African Americans, Black Americans metabolize medication differently than Caucasians. So what that means is that doctors, and I teach this when I'm training healthcare providers in diversity, equity, and inclusion and cultural competence, they need to start Black people on lower dosages of medications because we metabolize medications differently. So a lot of times when medications are prescribed to us, and I'm going to specifically talk in the mental health field, it's too much and side effects are experienced. And then people don't want to take the medication because of the side effects. So thank you, Dr. Lakeisha, for sharing that. Okay, look, well, look, I don't know, Dr. Tolu. I said Dr. Tolu, we might have another doctor on our hands, y'all. But okay, Tolu has her hand raised. Let's let Tolu have this last.
I'm sorry, my mom is here, so don't give her any thoughts. She's
all right,
really
Mom. We see your beautiful daughter.
shoving PhD PhD pamphlets in my face. I'm no, just kidding. But yes, so just wanted to say, that one, you are your number one advocate, right? As a 26-year-old, when I was calling trying to get appointments for a ultrasound, a mammogram, they were the insurance companies were looking at me like, we're not trying to cover all of this. Like, why are you going, right? And really having to have like that advocate of like, no, this is what my doctors, and really like getting all my doctors to make sure that they would like push it through and speak to, you cannot be quiet when you think that there's something wrong with your body, because every moment counts, like every single moment counts, right? And Dr. Morgan said it's really important to have people on the team that looks like you. Even if you don't, like my team, my care team is mostly, white women, right? But they care. Right. And if you find someone that's not on your care team that doesn't care, you need to speak up. I'm working and mentoring some young people, not with breast cancer, but that they don't feel heard, right? They don't feel like their doctors hear them. You need to change your care team, right? Because stress adds to your symptoms and you don't want to be stressed. You want to make sure that I have faith in my care team. I have faith in like the people who are supposed to be caring for me, and I trust their advice, right? So you want to make sure that you're advocating for yourself to your doctors, to your nurses. And if you feel like you're not being heard, it's your life at the end of the day. Change your care team. Like if you need to, I needed to change my care team at first. Now I have a great care team, right? Change at the end of the day. This is like you can't care about, oh, I don't want to hurt their feelings, or about, this is your life. Your life is more important and it's worth it. So like find the care team that you feel comfortable with. But yes, that is another story, Dr. McGee. I could talk about care team and healthcare all day long, but
we'll have to do another Talk the Wellness Tea with Dr. Chalice podcast for that, because you're right, that is a whole nother discussion. But let me just thank you, ladies, so much. I just feel so honored that you guys are here tonight, that you all shared your story with courage and bravery, and the stories of resilience, the stories of faith, hope, the stories of balancing, because our mental health is our thoughts, our feelings, and our behaviors, but our mental health also includes our physical and our spiritual health. So to hear all of us testify about how we are trying our best to balance all three of those things so that we can walk in our wholeness, our healing, and our restoration is so inspiring. And I know that, our stories and this time that we spent tonight is really going to inspire others. I thank you, ladies, so much. Thank you, guys. Bye, everyone.
Yes, thank you.
Thank you for having
Thank you,
us.
guys.
Thank you
No
so much.
Bye.
And people are in the chat thanking us as well. Thank you for
Thank you,
joining.
everybody.